Doug, you are hearing that some treatments in other countries may be helping people with COVID-19. Medical reporter Meg Farris wanted to see if those treatments are available for us in our local hospitals.
Clinical trials are already underway for many new therapies, and we're working on scaling these to allow many more Americans to access different drugs that have shown really good promise.
After President Trump's announcement today about promising treatments for COVID-19, we wanted to see what that means to us in Southeast Louisiana.
Have you used it at UMC on any patients who are really suffering?
Yes, we have been using hydroxychloroquine in patients with some with suspected and some with confirmed COVID infection who have moderate or severe and even critical disease.
LSU Health infectious disease physician Dr. Meredith Clement says the results locally have been variable, but promising in other places.
I do know that China is reporting that in 100 patients with it, all patients did extremely well.
She and other local doctors are also looking at very early, small, unpublished studies overseas, combining hydroxychloroquine, used for treating lupus and rheumatoid arthritis, and the antibiotic azithromycin.
And they did show that the viral loads came down.
Dr. Clement says they're also using an antiviral drug that treats the Ebola virus here locally called remdesivir. But she warns all of these medications, along with chloroquine, used for decades to treat malaria, need more studies.
These drugs are investigational. We are in the early days, and we have only preliminary data to work with.
And she has some concerns if there were to be a shortage for people with lupus and rheumatoid arthritis. Meg Farris, Eyewitness News.
Well, even though there are decades of experience with these drugs and they are generally safe, there are concerns about side effects and overdose fatalities. Tulane Lakeside announced that its emergency room will temporarily close effective tomorrow at 6 p.m. Tulane Health System says that this will allow them to move critical staff to the downtown campus to help fight the COVID-19 outbreak. Tulane Lakeside says it does not have any patients being treated or awaiting test results for the coronavirus.